What are the possible security attacks that might occur in healthcare? So especially in healthcare projects, like for example, when we take an application, either at web application or a mobile app or the web services or even the database, or we have any data projects. So all these, the possible attacks, the generic possible attacks. So mainly we'll have like kind of DOS attacks. So that is very one of the very thing where in DOS attacks, what they do is actually they inject a lot of traffic, which is like malicious traffic to the servers and make the servers to stop, so that it will not serve the healthy or the organic traffic, but it will. So because of the inorganic traffic, so that is coming, though there is a possibility of the server shutdown, and this possibly lead to an attack. Similarly, ransomware attacks are also one of the possible thing, and recently that has been seen in many cyber security areas also. Like for example, uh, this is actually injecting some scripts, malicious scripts, and they are corrupting the sensitive data, and for that, and they're encrypting the data so that the application users cannot use the data. And for that, actually, in order to bring the data to normal state, the hackers are charging the amount, which is called some kind of ransom pay amount like that. So that is one of the attacks which is being seen recently in many areas. And even data breaches, especially for healthcare, we have like kind of sensitive information, sensitive like patient's health information, and these are all the main sensitive informations. So there is a possibility of if this data is not protected, so there is a possibility of breach. So where this data should not be exposed, and that might lead to different privacy violations. And phishing is one of the very oldest attack, just like DOS attack, like kind of an email intruding. So kind of a malicious links that are injected in the emails, and so click on that links of that email might inject script and capture the user session from the whatever the application he has logged in. And similarly, broken authentication and broken authorization. Like for example, it is like if the passwords are not strong enough, and even the access roles are not being defined properly, so there might be possibility to attack. Just like if we see like a kind of a rainbow attack earlier we used to have, like where they store the defined passwords and they use permutations and combinations to capture these user IDs as passwords, and they do these attacks. Similarly, SQL injections we see mostly in our projects, like kind of the projects, the applications are running SQL queries. So they inject, they actually malform the SQL query, and they'll be able to get the data from the database through this malformed SQL query. Similarly, cross-site scripting is also one of the very oldest one, like kind of injecting the script in the user in the browser loaded script. Like for example, a malicious script is injected into the application JavaScript, and that might actually invoke the user's URL, the application URL through the user session captured. So these are the different possibility security attacks that might occur in healthcare. And now there is a necessity to prevent all these type of attacks, and our application should be very strong enough to protect from all these attacks.